Yes. How many of you got up this morning and said, yes, I get to learn wound care?
Oh, yeah.
Every one of you, I'll bet, huh? You've all been waiting for 1:30 this afternoon for the wound care. I'm assuming you all have this little kind of cheat sheet here. I have to thank Larry because Larry did a lot of the research for me, so I want to thank him for that too. My name is Nate Varelli. I am the director of our Outpatient Wound Healing Center. The center is in the process of being opened and should be open sometime in November over on Good Drive in Lancaster. I tell you that because the types of wounds or maybe even the products or supplies that you'll see when you consult inpatients are going to be a little bit different than what I would see. So I hope that you ask some questions and we make this as interactive as possible too. The other thing that I want to do, every time that there is a new hire orientation, everyone always goes, I don't want to follow Missy Deibler, because Missy gets in and when you leave everybody's just so excited to be here. So you don't ever want to follow Missy Deibler. Well, Missy gets to follow me today. So let's make this the best one so Missy goes, oh, I don't ever want to follow Nate for anything ever again, if we can, all right? Terms and technology, wound care terms specifically for inpatient. Wound care really goes hand in hand with two other terms, ostomy and continence. And first off, when we speak about wound care, we are talking about treatment of patients with acute and more than acute, really chronic wounds. And anything chronic is anything that is 30 days or older that is just really stubborn and non-healing. That's the type of wound that we're talking about. We're not talking about the kiddo that falls on the playground and gets the little, burn on his knee and you put some Neosporin on it and he's okay. No. That's wound care. Now, ostomy or stoma, those two terms are really sort of interchangeable. And a stoma is an opening that's either natural or surgically created. So a natural stoma would be your mouth, is a good example of a natural stoma. The reason that it is important here for inpatients is a lot of times surgical stomas come in the form of trying to avoid a disease that's in the gastrointestinal system. So the one that you'll probably see most prevalently is a colostomy, or you're trying to avoid the colon, so you surgically open a stoma somewhere else and then have a bag, a colostomy bag, that is there to collect the waste as well. The idea with stomas is that you really want to try to continue to allow the body's natural digestive process to happen for as long as possible. So when doctors do or surgeons do stomas, they want to try to do it as far down the gastrointestinal tract as they can to continue to let that normal digestive process happen as well. And we did talk about the removable pouching system. Colostomy, again, it's just an opening near the colon or at the end of the large intestine to drain that pouch. You'll always see the word stomy at the end of any ostomy or anything, and then the first part will be the body part that is usually associated with it. So appendectoscomy, or however that's said, is basically the appendix area, or esophageal scomy is anything in the esophagus. Ileostomy is another one that you may see. The ileum is another name for small intestine, so if you see the word ileostomy, it's just that's the bypass of the small intestine that way. And then the last term that you see really in conjunction with wound care and ostomy is continence. Continence is just simply bladder and bowel control for a patient. What you may hear is the term incontinent, and that is just that those folks do not have control of those functions. So, and then it's worth noting too that there are nurses that specialize it, and they're known as WOCNs, wound, ostomy, and continence nurses. To my knowledge, I'm not sure. I don't know that we have one of those here at Hart. I believe that Lancaster Regional has one, but that is a term that you may see as well. So that's the basis of terms on the inpatient side. Has anyone heard anything in terms of wound care or have any questions on those terms that we just described there? Yes?
I guess I'm wondering why had that been originated? Why wouldn't the person just go to their family doctor to get this stuff taken care of, instead of just going to another specialist? Is it a new field?
It's a fairly new field, yes. And I'm assuming you're talking about ostomy or continence or wound care in itself?
Primarily.
Wound care? Well, wound care has become very specialized, and that's the case for several reasons. The influx of diabetes. Diabetes has become basically an epidemic, and in this area, because of our very fatty food and the rich cooking that we have a very large supply of diabetics here as well. Why don't you go to your PCP for that or primary care physician for that? Well, a lot of times those primary care physicians really don't want those wounds in their office. They're tough to heal. They're time consuming and dollar consuming. The patient may get frustrated if he keeps coming back and you're not having any progress with it. So this wound care specialty basically developed for those folks, mainly diabetics again, who maybe did go to their primary care physician and couldn't get it healed. And finally, primary care physicians started throwing up their hands going, I have to have somewhere to throw this wound to because I can't heal it here. Now, the other thing is hospitals and nursing homes are having problems as well because anytime there are wounds that are acquired inside the facility, they're getting fined for that as well. So hospitals and nursing homes, they want those wounds out of there. So if they send those folks to the hospital, before they come back, they're going to say, hey, listen, discharge planners, did you talk about discharge planners or case management here today? I want some sort of course of action so that we can prevent this wound or we can heal this wound before they come back to our facility, because I don't want our state surveyors to come in and say, they got that pressure ulcer or bed sore here at your facility, you're getting fined for that. Yeah, good question though. Anyone else? Okay, now this is my favorite part, the technology here, the second page. And we talked about that, the first line. Why is wound care becoming such an important specialty? Diabetes. And again, there's a good stat there. It affects 26 million Americans, almost 9% of the population. Let's put it this way. If you see roughly 10 folks in a day, 10 patients in a day, odds are at least one of them is going to be a diabetic, which just surprises the heck out of me. I never would have thought that, and that number's on the rise. It's not going down. So diabetes is an increasing issue. This next one, it just blows my mind. On average, every 30 seconds, somewhere in the world, someone loses a lower limb as a result of diabetes. That is absolutely amazing to me. And when you talk about diabetes and you talk about lower limb amputations, you're basically signing a death sentence for these people, because any diabetic who has a lower limb amputation, within 5 years, they have a 50% chance of dying. So the wound care, great question again. The reason it's come up is limb saving, life saving. Diabetes is a terrible disease. People with diabetes, they are at increased risk, and this may help answer your question too as well. Why are diabetics those folks that we see more often than not? First off, it decreases blood flow. Blood flow helps wounds heal. So if diabetics have poor circulation and they can't get that blood flow down to that foot or that extremity, it's not going to heal as well as a non-diabetic. Secondly, diabetics have something called neuropathy. Neuropathy is basically just the idea that you can't feel anything in your lower extremities. So a diabetic may have a cut or a wound on their foot. They may not even know it. They may walk around on that foot and continue to have it become worse and worse and worse, just simply because they can't feel that area as well. So that's the reduced sensation that is there. Now, I usually like to end with what wound care isn't and what wound care is. And while I'm talking about that, I actually brought some product supplies along here. This is by far my favorite thing to talk about, because back when wound care was first started, wound care used to be something called wet to dry dressing, and that may be something you've heard before. Wet to dry basically is you take a piece of gauze, you wet it down or make it moist with some saline, and you put it on a wound. And when that gauze dries, you rip that baby off, and the idea was anything bad would come off with it. Well, unfortunately, a lot of times good stuff would come off there. Healthy granulated tissue would come off as well. So we've gotten past wet to dry, and in most cases it is still used. And now we're using different types of dressings, and I'm going to pass a lot of these around, because when I started to look at these, I could not believe how complex these dressings are now. This is, and here Larry, I'll start some of these with you. This is something called Optifoam by a company called Medi-Honey. Medi-Honey, the hospital here and at Regional, we have contracts with this company, Medi-Honey, to use their products as often as we can, because they're a fantastic company. Here's another one as well, and I'll leave some of them open for you as well. This is a fantastic one. This is a foam dressing that is cut in the shape to fit a sacral wound, or a butt wound really, because that just seems to be where a lot of your pressure ulcers are, especially for diabetics. So they were having to take those square or rectangular shape and just sort of make it fit. This is perfect. It fits very well. It comes in a variety of sizes for folks too. So we'll pass some of those around, then I'll go over this way, hand some other ones out. This may be my all-time favorite. This is called Medi-Honey. You would not believe it. Honey actually has healing properties in it. these dressings are calcium alginate dressings that have honey in them. And they don't open really easily, but you know what, I'll pass them around while we're doing that and we'll see. But I have others that may open a little better for you as well. So we've got dressings now that have honey in it. Again, we're not talking just saline wet to dry anymore. Here's another one that's very interesting as well. This is that Optifoam that I passed to Larry, and it started around this way, but it's called Optifoam Ag, and the Ag is silver. The mineral, not the color. So actually the mineral silver, again, same thing. It has healing properties in it as well. So this is silver impregnated dressings that when you place on there, it helps aid certain types of wounds in their healing that they have as well. So we'll start to hand those around too. And then I've got, I have another honey one too. I just think that's the coolest thing. Can you believe that there's a dressing that's got honey in it now? Here's some too. We'll pass these around there. There's some honey dressings for you. Some more Optifoam that's there. We got some silver ones. I know, we're all going to be going over to, what is that, Dr. Gold that's in Lancaster?
Don't we have less and less?
Yes.
So that gives you an idea now of how the dressings have changed. Again, we're not just saline wet to dry. We're not just throw a wet piece of gauze on there, when it dries, rip it off and hope for the best. No, that's not what we do anymore. We've got these products that now have additives in them that help the healing process. These are, and also another one of my favorite, this is basically skin care, but it can be used in wound care as well. Medline has these products that are color coded, so it's basically NATE proof is what I call it, because even I can figure out how to use these things. Purple means re-moisturize, or purple means to help clean out a wound or things like that, and orange means something different. But take a look at these. They're all safe to use for the average consumer as well. So yeah.
Can these be bought in a drugstore, local store?
Not usually, no. Usually you have to go to a medical supply company to get those, but
The average person couldn't go.
that's a very good question. I would suggest to speak to someone in case management, like maybe you saw earlier today, or you may be able to speak to a pharmacist or your family physician is who I would speak to, because they either will have those on hand or at least have a contact for you to be able to do that. More often than not, the folks that use these are home health care nurses. They've got the diabetics who are at home who can walk around and do the majority of things, but maybe they just can't reach that wound to change the dressing. So home health care nurses are also a great source for that. These creams that are around, they're amazing. The healing properties that are in them are outstanding, but they smell fantastic. I mean, I gave one to my wife, and she uses it on her hands every day, and it has like an orange smell to it, too, so it's great. And I'll continue to pass a couple more around here. I just think these are fantastic. There's another, yeah, that's another alginate with some silver in it.
Yeah.
We'll pass these around. We'll bring them over this way, too. I bring gifts for people. This is why you're going to hate the following. You're going to rethink this whole process, aren't you? That's right. You better have chocolate or something. I have set you up. You're in trouble. And, oh, there it is. Okay. And again, while we're passing those around, the last thing I like to talk about again is what wound care isn't and what wound care is. It isn't just changing gauze anymore. Again, it's not just saline wet to dry anymore. Rip it off, hope for the best. Not anymore. It is newer advances, and we talked about silver impregnated dressings. Skin substitutes. I couldn't bring any of those along because they have a shelf life. They need to be refrigerated, and they're also thousands of dollars per piece of skin substitute. But basically what that could be is, depending on the product, it could either be bioengineered skin tissue, or it could be actual, what was former living human tissue that you put into a wound, and it helps regenerate that skin in a wound that is that lacks the healing properties. Wound vacs. How many of you have heard of a wound vac before? I'm sure a lot of you have. How many of you have seen a wound vac before? You have. Okay, I have a wound vac that is here that I brought. So those of you that haven't seen it, if you spend enough time in a hospital, you're going to see it, because these are becoming increasingly more and more popular. This is the base of the wound vac. This is by a company called KCI. KCI is really the leaders in wound vacs. The science behind a wound vac is wound vac has their own dressings that they lay over top of them and sort of force down into the wound bed. Then they place a seal over top of the wound, and that seal then has a hose that kind of comes back to this unit that is powered. when they turn it on, it's negative pressure. It's almost like a vacuum. So it sucks that in, and what it does then is it sucks the dressing, which helps pull all of the bad things, I guess is the best way to say it, out of the wound. So it helps heal the wound that way as well. Those tubes then do go to a bag that help kind of drain everything out. And the idea is continue to change those dressings maybe 2 or 3 times a week, and that wound will heal faster that way with the negative pressure therapy that we have here as well. And what else do I have listed here? Oh, hyperbaric medicine. That's the coolest yet. Yeah?
In the past, before those wound vacs, your body had to dispose of all that naturally.
Yeah, that's absolutely the truth. And the thought process again was, let's put a piece of gauze or let's put a dressing on there. Time will let it heal, and it does. I'm not trying to say that your body won't heal itself, but a lot of times in diabetics, they need that aid. And that aid now comes in the form of negative pressure or a wound vac that sucks it out.
I've seen those used in my visits in staph infection, things like that.
That's a very good one.
Primarily what they're used for.
I don't know that I'd say primarily, but that's one of the main indications. The other one are just slow, chronic, non-healing wounds. Those wounds that just, you know, they're just not healing right, you know. Yes?
How often do you change them? You said 2 to 3 times?
It depends, really. It's going to depend on what the orders are, but I would say more often than not, it's going to be 2 to 3 times a week. Yeah.
I've seen it, but we used to, it's like a foam type.
It's silver in color. It's not that silver metal again. Yes. It sort of has a tacky pad that sits over top of that foam, and then the thing comes out. No. Yeah, well, there are different ones now, and actually KCI is coming up with new ones. If you feel this, I mean, this probably weighs about 10 pounds, and it's designed mainly for inpatients because they're not going to do a lot of moving around. There's a smaller one, an outpatient one that we'll use in our facilities that they'll take home, and home health care nurses will change those dressings 2 to 3 times a week. Now, there is a new one that they have that is disposable, and that's the craziest thing I've ever heard of, if you ask me. It's literally a box like this that is a vacuum that you put it on for 7 days, and after those 7 days, you throw it away. So it's quite expensive, but you know, if you really do a lot of moving around and you know you're an active person, you don't want to lug this thing around, because let me tell you, if you want to hold it, it's not something I'd want to lug around all day. This new disposable bag it'd be a heck of an exercise. Yeah, it really would. You're right. But you know, just as soon as you feel like I've got the latest, somebody else comes out with something new. So yeah.
Where do you pick up stuff like this?
Like that? Something more like this that is skincare, you may be more likely to find it than what we were talking about, the dressings and things. Skincare stuff, you may be able to find at CVS or Walgreens or things like that.
like it.
Yeah, it's nice, isn't it? And it has an orangey smell to it, doesn't it? They all kind of do. I would share that. And if you can't, ask your physician and tell them, listen, Medline is named, M-E-D-L-I-N-E is the name of the company. You can tell them, and they have creams that go all the way from diaper rash cream to cracked and scaly skin to, you know, infectious disease on your skin and things like that as well. So I would ask your primary care doctor, see what they say, if they have any. And if not, they should at least be able to get the rep in there to give them some samples and things like that too. So any questions before I talk very quickly? Yeah.
How painful is it for the patient when they change the dressing? Because I do know somebody who said it was really, really painful.
It probably is. Yeah, it probably is. And you know what? I've never had one, thankfully, but I'm told that it can be painful. The technology is sort of the same as we had talked about with that wet to dry. The only difference being that we've really sucked a lot of that bad tissue out. So it may hurt a little bit more whenever you take that off. The key to it all is going to be, can you do it in a delicate way so that it doesn't hurt as much whenever you do it? Because I know if it were me, and 2 to 3 times a week I'm having to have somebody literally rip something off of my skin, I'm not going to want to do that for very long. But this is a great technology and it does work, so you need to try to help those patients realize that even if it does hurt that little bit, look at how much better your wound looks from the half a week that you've had this on. So, yeah. Last thing I want to talk about with technology is hyperbaric medicine. Truthfully, in an inpatient process, you're not going to have any real experience with it, but it's something that's good to know because you may hear it with a physician who's talking. When we have this facility that's coming in, our Wound Care and Hyperbaric Center, we will have 2 hyperbaric chambers that are there. And folks, there's some confusion with hyperbarics. Hyperbarics is not bariatrics. That's very different. Bariatrics is the weight loss surgery. It's the weight management program that we do now have here. Hyperbarics is, for lack of a better term, it's a clear MRI tube is what it looks like. You lay a patient in there. It's pressurized to basically equalize the diving pressure when you dive 33 feet underwater. And then they breathe 100% oxygen in there. And I know you're thinking, that's the craziest thing I've ever heard. Why would that work? Well, the science behind it is under pressure, your body then helps generate more oxygen through your tissues. And again, we're talking about diabetics here who don't get that blood flow down to their wounds and their extremities. So it's hyperoxygenating their tissues, or it's adding more oxygen to their tissues so that it's speeding the blood flow, it's speeding the healing of these wounds that way. So not here, we don't have it here obviously, but it is over on 90 Good Drive. We'll have a couple of those, and that will be the primary indication we'll use it for. The other thing you probably heard hyperbarics from is it was what Michael Jackson used to sleep in before he passed away, but obviously not an approved indication for it. But the majority of usages now are diabetic wounds. You had talked about MRSA or things like that as well. If you get into a necrotizing fasciitis or like a flesh-eating disease, hyperbarics can work for that. Osteomyelitis, which is a bone infection. So if you have an infection that is so bad it's all the way down to your bone, that hyperbarics can do for that as well. It was started actually to treat the bends. Navy divers would dive down and they didn't know any better, and they'd come up as fast as they could and they'd get decompression sickness, or they'd get the bends, and some of them actually died from it. And then that's how they realized that this hyperbaric therapy could work that way. So it's good to maybe just know a little bit about it, because hopefully at some point in time some inpatients may be able to be treated for that as well. And then the last thing I have, we sort of talked about this, wound care isn't, somebody told me this and I had to laugh, wound care is not a sexy specialty at all. It's gross, it really is. I mean, it's wounds that don't heal and they drain and well, it's just gross, you know. Try going to a dinner when you're talking about this stuff, it's awful. But what it is it's dollar saving. We talked about it. The hospitals are getting fined now. Nursing homes are getting fined now. And you know, even if they're not getting fined, Medicare's not paying. They're not compensating for wounds that are acquired in a hospital. So you could really be treating this person and not getting any, any reimbursement for it at all. More importantly than money, though, it's limb and life saving. We talked about it. Limb amputations for diabetics are a death sentence. So the idea is to apply this new technology, the hyperbarics, wound vacs, all of these dressings that we have, so that we not only save a limb, but in the end we save a life as well. Any questions from anyone?
This
Yeah.
center that you'll have over on Good Drive, there's going to be inpatient rooms for patients to stay there? Or
No, it is
this
strictly
just
outpatient.
in
Yeah, it is 5 treatment rooms and 2 hyperbaric chambers that are there. And then the idea is for wound care, they'll come same time every week. If you're a Monday at 8 a.m. person, Monday at 8 a.m. you will be there every week until that wound is healed. Average healing time is roughly 5 to 6 weeks, and that is outstanding. I know some people might say, well, that's a long time. We're talking about diabetics who literally may have had wounds for years, and in 5 or 6 weeks, if we can get that healed, can you imagine how happy that patient is going to be? But no, good question. Right at this point in time, we don't have the ability to treat inpatient. Anyone else? All right. Well, thank you very much. I appreciate it. Did I take it off your time? Yeah? I'm going to